Good afternoon. Thank you so much, Amy, Dr. Brunader, and Leah, for being with us today for this Lane County Community Health Center's question and answer panel. You have a great internship program going out there at the CHCs, and we just wanted a chance to talk with y'all about it today. So thank you so much for your time. We look forward to hearing what y'all have to say.
Wonderful. Thank you so much, Laura. Yes, as mentioned, I'm Amy Sibul. I'm the internship director for the UO Human Physiology Department, and I feel that there's some great synergy between our program and the Lane County Community Health Center. So we want to get a little information out there, and I have a few questions to ask you. So first of all, what is the mission of the Lane County Community Health Centers, and why is there need for these kinds of centers in our community? Oh, make sure to unmute, Richard.
Yes. And so I don't have our mission statement in front of me, unfortunately. I should have had that. Leah, do you have it memorized by chance? Leah
No,
has it.
I do have it. It's to improve the health and wellness of our community through access to affordable and holistic healthcare.
What I want to add on in reality is we're here to help those who have difficulty getting help anywhere else. You know, and that's where I really think that we have a unique role. If there's nowhere else to go, we want to have the infrastructure that you can come and that we can help you.
Yeah, that is a much needed hole in the community, right? And so that what you're doing is really contributing to the resilience and health of those who aren't getting access to healthcare elsewise. So that's fantastic. So as we're talking about kind of the UO human physiology majors, what kinds of full-time positions would a recent graduate from our program maybe be potentially qualified for within the Lane County Community Health Center facilities?
There's a number of potential positions within health and human services with the county that could be of interest within public health or the CHC. And the intention of the internship program is really to open it up for U of O physiology students and other students who are interested in pursuing careers in medicine. So we see it as a way to really support people in getting to their next step in medical school, PA school, in with nursing, etc. So while I think there could be positions available within the broader umbrella of health and human services, so far people have been interested in really pursuing a career in medicine, and that's what we're here to help students do.
Excellent. So openings for both those continuing in their undergraduate education and also recently graduated and maybe have medical school on their horizon the next year or two. Fantastic. Okay. Where would students look to find out what these openings for internships and maybe, recent graduate positions are?
There are a number of positions listed on the Lane County careers page. So when the internships become available and open, those will be listed on the Lane County careers page. And there's a lot of positions available, some of which U of O physiology students might be interested in. So at any given point, you can pop on there, Google Lane County careers page. There'll be a bunch of listings that pop up. And yeah, we really encourage students to apply, especially the internship programs. We're having at least hopefully a few a year. And so there's multiple opportunities for students to get in here and learn what we're all about and taking care of our patients here.
Fantastic. What can students expect to be asked for during that application process?
I can answer this and Richard, jump in anytime. They can, the application is a kind of a statement of essay about why they want to do that and a CV, a resume, and nothing more than that. And then we do conduct interviews with students. And then should they be selected, they start interning and shadowing with our various providers here at a pretty flexible schedule, about 1 day a week, broken up to really meet the needs of a student schedule with classes.
That's so nice. I love hearing when internship providers recognize students have classes that they have to navigate and other obligations. That's fantastic. When students are onboarded, what kind of things are they expected to complete as far as, say, immunizations, background check, that kind of thing? Richard, do you want to flag that one? Do you have that?
Yeah, I can do that one. It's a standard employment. So you're going to be in a healthcare setting. So usually there's a tuberculosis screen that goes about. We probably, again, there be a healthcare setting. So I think we check the standard immunizations. In Oregon, you're not mandated to have them, but we at least like to go over and make sure that you're aware of what you need to happen. And I would suspect if they are an employee, like any other employee, there'd be a criminal background check. Interestingly, we check their driver's license, as we found out. So it's pretty much a standard process of like what you would. Well, actually, it's good because you're going to learn what any other place would do if you're going to apply in a healthcare setting. Like Leah, one thing I'll mention to you later is one thing I realized we're not doing. We should, but I'll talk to you about it later. Come up. So,
that'll come up with future interns for sure.
Yes.
Then.
Yeah.
That's great. Yeah, this is it's always an evolving process, right? And it's a great reality check for students who are trying to get a handle on what the professional world is like. They get that nice view during their education.
Yeah.
We know these positions are competitive, and that there's high interest in them. What are some recommendations, some bits of advice you have that relate to the kind of non-academic things a student can do to be a competitive applicant for these types of positions?
We're really interested in people who share our mission, our passion to serve, specifically our passion to provide primary care for underserved and marginalized community members. And so that really shines when people have that passion and that background. And Richard, do you want to jump in and add anything?
Yeah, I look at it as a twofold thing. One, something I've used, 16 hours a day of something you enjoy is less fatiguing than 8 hours a day of something you don't like. So we're looking for people. So different healthcare settings are different. So we're looking for people who want to do the kind of healthcare that we do. And we're looking for people with the background that they can achieve it. So if you don't have the background, you can have all the desire in the world and it won't help. And you can have all the knowledge and interest, but if this isn't your interest, it is going to work. So we're kind of looking for both ends that we can. And the other piece, I'll be honest with you, is if they came from like my background, I had no knowledge of medicine. I bumbled into what I did. That was not the smartest way. And so I think to give a person exposure early on can really help them. And sometimes an intelligent decision is, this is not for me, or I thought I was interested in this, but, or gosh, this is it. And sometimes knowing this is it gives you all that extra drive to study that extra evening for the final, because this is what you want to do. You know what you want to do, So I think getting the right person can really be a win-win for everybody, including society.
Man, I couldn't have said it better. Those are actually fantastic closing remarks to inspire students to really engage with experiential learning opportunities at Lane County Community Health Centers and to really figure out, is this for you? How can you can contribute? How can you serve those who are underserved and really forward your aspirations in a medical and healthcare field? That's fantastic. I think that's it. That was the final question. I'm so grateful for your time and thank you so much. I'm inspired to keep connecting UO Human Phys students with you. So
Yeah.
Thank you.
Nice to meet you.
Thank you. You as well.